All right, let's talk about something I'm willing to bet has happened to every single person listening. That weird, sudden head rush you get when you stand up a little too quickly. You know, that dizzy spell? Well, it turns out there's some really fascinating science behind that feeling, and we're going to break it all down.
I mean, you know exactly what I'm talking about, right? You pop up from your chair, maybe you're grabbing something from the kitchen, and for just a second or two, the world gets a little fuzzy. Most of us just shake it off and move on. But what if I told you that that feeling actually has a medical name and a really specific definition?
Yep, it's called orthostatic hypotension, or just OH for short. And it's not just a vague sensation, it's something doctors can literally measure. We're talking about a real, sustained drop in your blood pressure, specifically your top number dropping by at least 20 points or your bottom number dropping by 10, all within 3 minutes of you standing up.
Okay, so we know what it is, but the big question is, why does it happen? Well, it turns out there's this dramatic, split-second chain of events happening inside your body every single time you decide to stand up.
Get this, the moment you go from sitting to standing, gravity just goes to work. And it's not a small amount we're talking about. Between 0.7 and 1 liter of blood instantly gets pulled down into your legs and abdomen. That's like an entire large bottle of water suddenly shifting inside of you.
Now, your body is supposed to have this amazing lightning-fast system to counteract that, but with orthostatic hypotension, that system just glitches for a moment. So let's trace it. 1, you stand up. 2, all that blood pools in your legs, just like we said. And 3, this is the key. Your body's automatic response just doesn't kick in fast enough. And the result? Step 4, for a brief moment, your brain isn't getting enough blood, and boom, that's your head rush.
So, if this is all about a failed response, what's causing that system to fail in the first place? And who's most likely to have this happen to them? Let's zoom out a little and talk about the causes and risk factors.
First off, this is way more common than you might think. For adults over 60, more than 20%, that's more than 1 in 5 people, experience this. And this isn't just about feeling dizzy every now and then. It's actually a really big deal because it's strongly linked to falls and fractures, which can seriously impact someone's quality of life. So why does it happen? Well, the reasons tend to fall into 2 big categories. On one side, you've got neurogenic causes. Think of this like a problem with the body's internal wiring. The nervous system itself isn't sending the signals correctly, which can happen in conditions like Parkinson's. Then, on the other side, you have non-neurogenic causes. This is more like an issue with the body's plumbing or fuel, things like being dehydrated, side effects from certain medications, or even some heart conditions.
Okay, some of the symptoms are pretty obvious, right? Dizziness, maybe your vision gets a little blurry, you feel weak. But here's a really interesting one you might not have heard of: coat hanger neck pain. It's a very specific kind of pain that spreads across the neck and shoulders, and it's thought to be caused by that lack of blood flow to those muscles. Kinda wild, huh?
And this is probably one of the most important things to understand. You do not have to feel any symptoms to have OH. Some people's blood pressure drops when they stand, but they don't get that classic head rush. They're totally asymptomatic. But, and this is a big but, that increased risk of a fall is still there, which makes finding out about it really important.
So if we can be totally silent, how in the world do you know if you have it? Well, here's the good news. Finding out is actually incredibly simple and straightforward.
It's usually diagnosed with something called the active stand test. And it's pretty much what it sounds like. A doctor or nurse takes your blood pressure while you're lying down comfortably. Then they have you stand up, and they just check it again within 3 minutes. That's it. It's a quick, easy test to see if that big drop in blood pressure we talked about is happening.
All right, let's say the test shows you have OS. What now? This is the best part, the empowering part. Let's talk about the practical things you can actually do to manage it and take back control.
And I think this quote just nails the whole philosophy of treatment. The goal isn't to chase some perfect blood pressure number. It's not about that at all. The real goals are practical, to help you feel better, and, most importantly, to prevent falls. So, the first thing doctors will almost always recommend are non-drug strategies. We're talking about simple lifestyle tweaks, things like drinking more fluids and adding a bit more salt, after talking with your doctor, of course. It could mean taking a look at your current meds, or even using things like compression socks. And one of the easiest, most effective things, just making posture changes gradually. You know, sit on the edge of the bed for a moment before you stand up. Little things can make a huge difference. Now, sometimes those lifestyle changes just aren't quite enough to get the job done. And if that's the case, there are also effective medications that can help.
Doctors might consider prescribing first-line options like midodrine or droxidopa, which basically help your body keep that blood pressure up when you stand.
So there you have it. What starts out as a really common, simple feeling, a head rush, is actually an understandable, diagnosable, and most importantly, a manageable condition. We've seen the science, we've seen the risks, and we've seen the clear, practical steps you can take. It's a great reminder that you don't have to just brush these things off. Which leads to our final thought. Knowing all of this, what's the first question you'll ask your doctor?